Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Colon-resection-surgery, general, introduction. Your healthcare provider may have recommended colon surgery. If your healthcare provider recommends surgery, it is also your decision whether or not to have it. This patient education module will help you to better understand the benefits and risks of colon operations. Anatomy. The colon is the last part of the intestines and is also known as the large intestine. Swallowed food goes through the esophagus, also known as the feeding tube. This food then passes on through the stomach where the digestion process continues. The digested food travels from the stomach to the small intestine where nutrients are further digested and mostly absorbed. Finally, the fibers in some digested food reach the colon. In the colon, the rest of the nutrients are absorbed and stools are formed. Stools are then stored in the last part of the colon, the sigmoid and rectum, before being excreted. Arteries provide blood to the colon, and veins take the blood back toward the heart. The excess fluid is drained to the bloodstream through lymphatic tissue and lymphatic nodes, a network of vessels that run throughout the body. Lymph nodes usually help to fight infections, but cancer that starts in the colon may spread through the lymph nodes to the liver, small intestine, and other organs. This is how cancer can spread from the colon to other organs. The colon has multiple components. The ascending colon, the transverse colon, the descending colon, the sigmoid colon, the rectum, and the anus. Symptoms and their causes. Many colon conditions may need to be treated surgically, such as colon cancer, diverticular disease, and inflammatory bowel disease. Colon cancer is fairly common. It happens in about 1 in every 14 to 15 people. There are several ways colon cancer is found. It can be discovered in a routine medical exam, including rectal exam and scope exam through the rectum. If you have blood in your stools, it could be an indication of colon cancer. Abdominal pain, weight loss, malaise, and fatigue are also some symptoms of colon cancer. When colon cancer is found, surgery is usually necessary, both to remove the cancer and to check the abdomen's lymph nodes for any evidence of cancer. Diverticular disease is another condition that may require surgery. Many people have small pouches in their colons that bulge outward through weak spots, like an inner tube that pokes through weak places in a tire. Each of these pouches is called a diverticulum. Several pouches that happen together are called diverticula. Diverticulosis is the name for the condition where the pouches happen. About 10% of Americans over the age of 40 have this condition, and it becomes more common as people age. About half of all people over the age of 60, for example, have diverticulosis. When the pouches become infected or inflamed, this condition is called diverticulitis. This happens in about 10 to 25% of people with these pouches. Another name for both diverticulosis and diverticulitis is diverticular disease. These diverticula may rupture and spread the infection in the abdominal cavity. Surgery may be needed to drain the pus and fix the opening in the colon. Inflammatory bowel diseases such as ulcerative colitis or Crohn's disease may also require surgery. These diseases cause diarrhea, bleeding from the rectum, weight loss, and can increase the risk of developing colon cancer. The damaged part of the colon may need to be surgically removed to alleviate these symptoms if medical treatment doesn't help.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Other treatments. Once colon cancer is diagnosed, the best chance of a cure is through surgery. After the surgery, radiation therapy and chemotherapy may be needed to help prevent the cancer from spreading or coming back. Diverticulitis may be treated with antibiotics. Inflammatory bowel disease can be treated with medications. Surgical treatment. Prior to the surgery, the colon is cleaned thoroughly to decrease the chances of infection.
This is done using strong laxatives and enemas. The patient may drink a gallon of a special cleansing solution the night before surgery to flush out the colon.
This surgery is done with the patient asleep under general anesthesia.
The operation can be done through a big incision known as open colon surgery. It can also be done using special scopes and smaller incisions, a method which is called laparoscopic colon resection.
In open surgery, the surgeon makes a standard incision in the abdomen through which the surgery is done. During a laparoscopic surgery, the surgeon inserts a miniature video camera or laparoscope into the abdomen through a small incision. The laparoscope allows the surgeon to view the inside of your abdomen on an outside video monitor. 2 other small incisions are then made to insert tiny instruments and operate. In some patients, laparoscopy is preferable to an open surgery because the incisions are smaller, recovery time is quicker, and less pain medication is required. But in some medical conditions, open surgery may be the only option.
Sometimes the surgeon starts the operation using scopes. He or she may have to switch to an open operation if it is determined to be safer for the patient. 1 or more incisions are made in the abdomen. The abdomen is then entered.
The diseased part of the colon is taken out surgically and the remaining colon is connected or anastomosed back together with flexible stitches called sutures. Here are some examples of a part of the colon being taken out and how the colon is then put back together. This is the case of the removal of the ascending colon. This is the case of disease involving the transverse colon. This is the case of disease involving the descending colon. When the disease involves the lower rectum or anus, another incision may be made near the rectum. When that part of the colon is taken out, there may be no colon left to attach to the other part of the colon. At that point, the colon is rerouted to the outside of the abdomen through yet another incision. This type of surgery is known as colostomy. Sometimes a colostomy is necessary if the surgeon thinks that the colon cannot be successfully reconnected with an anastomosis procedure. This may be the case if the colon is not believed clean enough at the time of surgery or if there is an active infection that may threaten the anastomosis. If you have a colostomy, a bag is then placed over the opening of the colon to the outside to collect your stools. Bowel control is lost. If it is feasible, the colon could be put back together 3 to 6 months later. Your surgeon will inform you of this possibility. In cases of colon cancer, the lymph nodes are then dissected to determine whether or not the cancer is spread beyond the colon. The rest of the organs in the abdomen are also very carefully examined. Suspicious lumps could also be taken from surrounding structures such as the liver, small intestine, kidneys, or uterus to determine if they are cancerous. Risks and complications.
Colon surgery is safe, but there are several possible risks and complications. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early.
The risks and complications include those related to anesthesia and those related to any type of surgery.
Some risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, headache. More serious risks of general anesthesia include heart attacks, strokes, pneumonia.
Your anesthesiologist will discuss these risks with you and will ask you if you are allergic to certain medications.
Blood clots can happen in the legs. These clots in the legs can happen due to inactivity during and after surgery. They usually show up a few days after surgery and cause the leg to swell and are very painful. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is important to let your healthcare providers know if any of these symptoms happen. Sometimes the shortness of breath can happen without warning.
Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Some of the risks are seen in any type of surgery. These include 1. An infection, whether it is deep or at the skin level. Infections can involve the abdomen incision. Deep infections may involve the abdominal cavity itself. This is known as peritonitis. Treating deep infections may require long-term antibiotics and possibly surgery.
2. Bleeding, either during or after the operation. This may require a blood transfusion or another operation.
3. Skin scars.
Other risks and complications are related specifically to this surgery. These are rare, but it is important to know about them.
Structures in the abdomen could be damaged, especially if involved with cancer, inflammation, or infection. Such problems can include the following: the spleen, the stomach, and intestines could be perforated. There could be injuries to the urinary bladder and the connecting tubes. There could be injuries to internal female organs, such as the uterus and ovaries. Blood vessels going to the lower extremities could be affected. Unexpected difficulties could require an unplanned temporary or permanent colostomy. There could be an abdominal wall disruption or breakdown that would require another operation.
Damage to these structures could lead to permanent damage and the necessity to proceed with other operations. These are rare. Death is extremely unlikely, but it is possible.
Hernias through the incision or incisions are possible. This happens when the internal wall of the abdomen is weak and intestines push under the skin. Such a condition could require another surgery. Another possible complication is the breakdown of the anastomosis, or the area where the two ends of the colon are attached. This usually leads to an infection inside the abdomen, requiring another operation and a colostomy to reroute the colon. After the surgery. After the operation is done, the patient is transferred to the recovery room and then to a regular room. You will not be allowed to eat or drink for a few days to allow the anastomosis to heal. A tube may be placed in the stomach through the nose for a few days. It sucks out the air and the juices of the stomach. This prevents you from becoming bloated and nauseated while giving the anastomosis time to heal. You will then gradually be allowed to eat food. You should be able to go home in a few days, depending on how you're doing.
You will have to follow up with your healthcare provider to decide whether anything else needs to be done for your specific condition.
For example, in cases of colon cancer, radiation therapy or chemotherapy may be needed.
Make sure to contact your healthcare provider in case of any new symptoms, such as fever, wound drainage, severe pain, weakness, swelling, or infection.
Home self-care.
The following general instructions are given to patients who have had colon surgery before they go home. Your healthcare providers will review information with you that is specific to your medical condition.
Activities. Gradually increase your activities. Do not overexert yourself to the point of fatigue. If you become tired, rest more frequently. Stair climbing is permitted, but should be limited to once or twice a day. Climb steps slowly and stop to rest every few steps. Do not lift anything over 5 to 10 pounds. Driving, returning to work, and resuming sexual activity should be avoided until after the first post-operative visit with the surgeon. These activities will be discussed at this time. Unless instructed otherwise, you can shower when you go home. Tub baths are not permitted. The first few times you shower, it is advisable to have someone available to help.
Riding in a car is permitted, but you should stop frequently so you can stretch.
Incision care. Unless instructed otherwise, when you shower, wash the incision site with soap and water and rinse thoroughly. Pat dry, do not rub. It can be left open to the air and does not need a dressing. If clothing irritates the incision, a dry, sterile pad can be placed over the incision.
Inspect the incision every day and contact the healthcare provider if you notice increased redness, drainage, swelling, or separation of the edges of the incision.
Diet. If a special diet was prescribed, follow the instructions given to you by the nutritionist. Ask the nutritionist or your physician how long the special diet needs to be continued.
Medications. If you need medications, prescriptions will be given to you before you go home. Do not take any over-the-counter medication, including laxatives, unless advised to do so by your healthcare provider. Call your healthcare provider if you have fever over 101 degrees or shaking chills.
If you notice swelling, bleeding, redness, or drainage from the incision site, if you notice the edges of the incisions are separating, if you experience severe constipation, diarrhea, nausea, or vomiting, if you have an increase in pain, call your surgeon's office for an appointment when you go home. Your surgeon will usually want to see you about 7 to 10 days after discharge.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Conclusion.
The colon is the last part of the intestines and is also known as the large intestine.
Many colon conditions may need to be treated surgically, such as colon cancer, diverticular disease, and inflammatory bowel disease. Colon surgery is a very safe and successful procedure.
Risks and complications are rare. Knowing about them may help you detect and treat them early if they happen. Thank you for using Explain.